Namaste, everyone. I'm Dr. Karthikeyan, and we are going to be doing a series of these talks with very senior integrative medical practitioners over the next few months. And in the first series of these events, I would like to bring to the table one of the senior most and foremost practitioners of ozonotherapy in India, Dr. Arul.
Thank you.
Thank you for joining us, sir.
Thank you, Karthi.
Now, we know that Dr. Arul has been practicing integrative medicine for the last 15 years. And I would like to ask him by telling his experience of how he entered into the field of integrative and holistic medicine.
Yeah. Actually, I was a regular allopathic practitioner practicing in Pollachi and Annamalai, the small township. When I was doing my regular practice, I was not happy with the patients coming to me repeatedly for all chronic as well as acute ailments. And certain issues which happened in my family made me to explore more about other therapies, which I was very skeptical when I was practicing the regular mainstream medicine. Through that, I came across this ozone therapy. Actually, I have to remember Dr. Karnam here. He is the person who introduced me into this therapy in Mumbai. Through him, I got to learn about the ozone therapy, all basic steps. Then that developed more interest in me, so I literally jumped into this and started traveling around the world from Mexico to Japan. Met all the top people in ozone therapy, learned and brought the technology back to India, like EBU. In fact, I was the first to introduce EBU after learning the technology from Malaysia as well as in Germany those days. Next, I, along with my colleague Dr. Mohan Silvan, went to Austria, Vienna, it's important. Learned the 10 pass method from the inventor, Dr. Johann Lagodini, and brought that also to India. So, learning ozone therapy, as Dr. Chandan was telling previously, that getting a degree is just a beginning. Learning ozone therapy is also just a beginning. Once you have to jump in, then you have to swim. Then you can reach all the top therapies in the world. That's how I explore therapies. Like that, EBO, slowly I went into ECP, all these therapies which are helping my patients very well, especially take for the cancer. I practice high dose vitamin C, chelation, detoxifications, plus GC MAF, mistletoe, whatever it is. I just try everything. And I learned everything also. I keep upgrading to say constant refinement in these therapies makes me keeps me in the good books of the patients as well as my colleagues and my staffs also. Like
Yes.
that is the thing which I achieved in this.
Okay, sir. Thank you for reminding me to remember Dr. Karnam, sir, who's no longer with us and who's one of the leading lights in the
Yes.
field of integrative and holistic medicine. I would like to ask a few specifics on ozonotherapy and the EBU, which you brought into India as the first practitioner of EBU. And I also want to discuss a little bit about the leading practitioners of ozone therapy worldwide, of which twice you have also made Dr. Frank Schallenberger come to India. So, can you please talk to us a little bit about EBU and 10 pass method, which you have mentioned, and also about how we are liaising with the various organizations around the world, such as American Academy of Ozonotherapy and Dr. Frank, so on and so forth.
Yeah. EBO is just actually when I was trained, in fact, with Professor Oleg Maslenikov in Moscow. Sorry, he was in Nizhny Novgorod. He was instrumental in putting me to EBO. Though there are two schools of thought in ozone, sir. One is the Germans, the other is the Russians. Both are pioneers. Russians more in favor of saline drip and other things. Germans are in favor of major EBO and other things. So Professor Oleg Maslenikov was in touch with me for many years, advised me to go and learn and this. Though they were not practicing in Russia, he advised me to go here and learn these therapies. Like that, I learned EBO. and brought it to here. Ibu, it's really a wonderful therapy in chronic diseases. I find very good results in hepatitis B, HIV, hepatitis C, and fibromyalgia. These four conditions, I seen wonderful results, along with methylene blue injection also. 10% is something different. It's the high dose, 70 micrograms. But in EBU, we do only low dose, low volume, low concentration, like that. The 10% usually, that's also very good for chronics, but not for acute cases. I don't use it for acute patients. Only with the chronic cases, I use 10%. But both, if you ask me which is good, I really vote for EBU.
So your take is that Ibu is much better than
Yes,
Tenpa.
yes, yes.
And a lot of our viewers will be interested to know what is Ibu and what is Tenpas and what are the benefits of Ibu over Tenpas.
See, so there's no, we can't say what are the benefits between 10% and EBU. All are ozonation only. In EBU, your blood is drawn from one arm, which is circulated through the peristaltic pump, which pushes the blood to the filter. Ozone is mixed in the filter, then it goes to the other arm. And some unwanted extra fluid gets discharged through the other tube. Here, your cells are constantly bathed with O3, that is ozone. So, the bacteria, the virus, everything gets killed and thrown out. This we are seeing by doing pre and post EBO blood parameters. That is one thing. And if there is any oxidative stress in the body, the patient is put down to sleep. They won't even know when the ozone is ending unless we remove the catheter from the current. It's a good. We can't clearly say whether 10% is good or EBO is good. In my experience, I prefer EBO for chronic, especially for hepatitis B, C, HIV, and fibromyalgia. And even in cancer, I have tried. Probably if they have got good thick veins, then I do EBO initially.
Okay.
Like see a breast, lung cancer, it's good.
So, are there other applications of ozonotherapy, for example, in gut-related or autoimmune conditions?
Yeah. So we can do in gut, especially if you take for IBS, autoimmune disorders of the bowels. I do with my patients, whoever comes to me, I put them on rectal detox. That is a coffee enema, liver flush, plus rectal ozone. 3 days a week for 7 sessions, 7 weeks. After that, I make them do every week. I teach them and ask them to do it in their home only. They need not come every week to do these tests. I advise them to buy a small machine. I teach my staff, teach them how to do, so they keep doing in the house. They need not come here. And for the rest, I do major, minor, all these therapies, which according to the protocols or according to the need of the patient. I just blindly don't follow the protocol. I see the need of the patient. Accordingly, I put them on these therapies.
What are the other therapies that you are using currently in the management of your cancer patients?
So, cancer patients, I use high dose vitamin C, Ozone, mainly Evo. If I get a chance that the vein is good, otherwise I do major. Rectal ozone also plays a major role in these therapies. Then mainly vitamin C and ozone.
What about
Then I also add mistletoe. That is the anthroposophic medicine, the hormonal herbal homeopathic injection from Germany.
What about hyperthermias?
Hyperthermia also very good, sir. Hyperthermia, I've seen very good results in breast cancer and even in the pancreatic cancer. Both are very good. Especially in hypothermia, we have to give vitamin C and then hypothermia, or with vitamin C itself, hypothermia can be done on the same table. Results are good. I've been to Hungary and in Germany, visited 3 hypothermia clinics. Each clinic I saw 4 to 6 machines. Per day, they treat around 32 patients in hypothermia. So that therapy is very popular in the Western European countries. It is yet to, though we have one machine now, but more and more machine has to be introduced in our country. So that at the end, the people's quality, patient's quality of life, that matters most. And I also call this hypothermia as poor man's proton therapy. Poor man's proton therapy. That's it.
So we have a machine in Bombay and we have a machine in Pollachi. Now,
Yeah.
is there any plans for any further machines?
Yes,
hypothermia
yes,
machines?
yes. One we are expecting one in Chennai very soon. Very soon it will be introduced.
So that poor man's proton
Proton.
therapy is going to have a wider reach.
Of course, of course. Many, I spoke to a few oncologists in Chennai. They're also very interested. They told me, okay, let's introduce that in Chennai. Very soon it will come. Along with the, what you say, along with the low dose chemo. Actually, I also practice IPT, insulin potentiation therapy. Along with the IPT and hyperthermia plus vitamin C, I think cancer patients will have really some green light at the end of the tunnel.
Now, just to give our audience and viewers a bit of background on all these therapies, what Dr. Arul is talking about, most of the therapies, what he's talking about, are very commonly practiced in Germany and most of Europe and in the United States of America, along with Mexico. And some of these therapies are also practiced down under in Australia and countries like Japan and so on and so forth, So most of these therapies are at the cutting edge of anti-cancer therapy and anti-cancer treatment, which is being practiced here in India. And we just need to know, you just need to get to the right place and with the right practitioners
Yes.
to get the help
Yes.
for your condition.
Yes, that's right. We also we emphasize on the good diet.
Yes.
Diet is also equally important. I say my patient 60% is diet and 40% is my job. If you follow diet strictly, the rest 40 will work better than any other therapies. Second, sir, every illness has got an emotional background to it. So now we are planning to look into that also, that aspect, emotional well-being. So we are exploring certain technologies or methods which can be introduced very soon so that patients will really get benefited by using these therapies. Along with high dose vitamin C or whatever it is, any illness, even for gut. We used to say all disease begins in the gut. Now the latest is even brain is related to this is our second brain. Gut is our second brain. Now we have to address brain also. One command comes from the brain. 9 commands goes from the gut to the brain. So both are very important. Now we are finding ways how to treat that both. In a, what to say, biologically, without any side effects. All these things are these are all upcoming very soon.
No, I have to agree with you, Dr. Arul, on that because I have seen a few patients when giving them a good probiotic and it makes their back pain disappear.
Yes.
Now, you will ask, what is the relationship between back pain and probiotics? So, you have to get into the gut microbiome and gut microbiota, and that's a whole new science out there. We've got 10, 15 years of research backing it. And I'm sure Dr. Arul will agree with us that again,
Of
we are
course.
doing gut related therapies at the cutting edge of science here.
Yes, of course. Gut plays a major role for all illnesses. As you said, with a simple probiotic, the back pain is gone. Now, recently, there's a paper on curcumin, also turmeric, which also helps in curing the getting relief from the back pain after adding curcumin and other things like a resveratrol. Many supplements are there. Only thing is you have to go to the right person.
Yes.
That's the problem. Right person, at right time, and right patient will work together. That is very tough for the patients to find also. I think very soon everything will be coming in place so that everyone will be well educated in all these therapies.
So we would like to finish this here, Dr. Arul here, and thank him very much for his time. I'm sure in the going forward in the future, I would like to bring about bits and pieces of various therapies as and when required. And if the demand is there for a certain kind of therapy which you would like to know about, you can please let us know so that we can do a session or do a small video on those kind of specific therapies what you will be interested in. Thank you very much.
Thank you, yes. Thank you very much.